Hello, lab parents, guardians, and families. We are excited to present to you our first ever virtual open house video on behalf of our lab nursing department. We wanted to take this opportunity to introduce ourselves, who we are, what we do, how we support our lab community during these unprecedented times, and share with you some resources to help navigate the abundance of information that's out there. This school year is going to be unlike any other. It's different, it's challenging, and we want you to know that we are here for you. Our open door policy for students extends to families as well, and we are always an email, phone call, or Zoom meeting away. So many of you already know who we are, but if you're new to lab or if you've only corresponded with us over the phone or by email, we wanted to take this time to virtually meet you. So hi, I am Sasha Reed and I am the nurse leader at lab.
Hi, my name is Janelle Borowski and I work in the Lexington Health Office.
And hello, my name is Amanda McAdam, and I'm the nurse over at the Arlington Health Office.
So what is our role in school health? We direct care services, so we provide daily nursing care for our students. That includes scheduled, routine, and whatever else is needed whenever. We have an open door policy. We help in health education. So we help our students foster health independence by teaching healthy habits and self-advocacy, and we also train our staff in health and safety protocols. We deal with medical records, so that means that we collect, review, and maintain health documentation to ensure our students always meet the state criteria to be in school. And finally, we foster communication. So we facilitate all health-related communication to ensure our students' privacy is protected. Families can always reach out to us with any questions.
So we have a little bit of a different role this year because of COVID-19. Due to the pandemic, we have been increasingly involved with updating protocols. So we're developing and implementing our health and safety protocols to match the new directions that are coming from our local boards of health and from the Department of Education. We're doing a lot of staff trainings. So we're designing and delivering trainings to staff about COVID-19, hand hygiene, cleaning and disinfecting, and how to safely use personal protective equipment in schools. We're also working in kind of a consultation role. We're providing guidance and resources to students, families, and staff to help everybody navigate all of the information in these times. We're doing research and reviewing, following the updates to the medical research, the state and local guidance, the data metrics, and health trends to make sure that we are implementing our best practice. We're working with contact tracing, so identifying people who have tested positive, people who might be at risk, and implementing the quarantine protocols to help mitigate the spread of illness at school. And then we're kind of the funnel for all the documentation and the follow-up that needs to come back for your child, student, staff member to return to school. We're communicating with the school teams, with families, with health providers, local boards of health, and helping our students and staff to return to school safely.
So as you know, lab is unique in the structure of our programs and nursing is no exception. Many of our schools have on-site lab nurses serving students one-to-one, or the classroom as a whole, or the entire program. Other schools have the ongoing support of the district building nurses who care for our students as much as we do. For all program sites, however, we do help to facilitate communication and documentation for our lab students. We oversee all nursing care and accommodations, health plans, medical records, and we coordinate with classroom teams, specialists, providers, and district nurses to ensure your child's healthcare needs are being met. So if you have any questions, concerns, updates, or health forms to share on behalf of your child, please reach out to us. We are your go-to for all things health related.
So we have some reminders from the Lab Health Office. The first being seasonal flu vaccines are required for all students by December 31st, 2020. The meningococcal vaccine is required for all students aged 12 to 16, sorry. We are also seeking annual health intake and renewal forms. Those include physicals, medication orders, and emergency plans. If you are required to take a COVID-19 test, we remind you that it must be a PCR or a NAAT test. And finally, the close contact has been redefined by the CDC. So a close contact is now being within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, and that begins from 2 days before symptom onset until the time the patient is isolated.
We also have a hub for all the information that we are sharing with you. We have created a virtual health office where you can find easy access to our contact information, to contact a lab nurse who is at your child's program site, or to schedule a virtual meeting. We have a featured health topic with up-to-date information on current health issues and events. We have a COVID-19 information and resources tab, and we have a health office bulletin, which we are using to reference our updates, different reminders for the school year, similar to what we just mentioned.
So this concludes our presentation for today. Thank you so much for your time and attention. As always, if you have any questions or concerns or simply want to check in, please don't hesitate to reach out to us. We always look forward to hearing from you. So take care, everyone. Be well, and we'll talk soon. Bye.
Bye.